Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight, a new order by the National Medical Commission that says that doctors will be penalised for failing to prescribe generic drugs has got several leading doctors in the country quite upset. Doctors may now even have their licenses suspended if they don't follow the rules. The idea is simple. At one level, generic medicines are 30 to 80% cheaper than branded drugs. India spends massively on public healthcare costs. The government is trying hard to bring this down. But shouldn't there be a freedom of choice? And aren't branded medicines, even if they are branded generics, and that's a special India-specific category, aren't branded generics of a higher quality than just generic drugs? Also on this program, the head of the World Economic Forum's head of health and healthcare joins us. He's here for the G20 meetings, India's digitalization of health, pandemic preparedness across the grouping, and a lot more. But let's talk about branded drugs versus generics. Joining us at this stage, Dr. Sharad Agarwal, President of the Indian Medical Association. I'm also joined by Dr. Girish Mathur, President of the Association of Physicians of India, and MC Mishra, former Director of the All India Institute of Medical Sciences. Dr. Agarwal, first question to you. We spend massively on public healthcare in this country. If generic drugs give us a cheaper option, what's wrong with it?
No problem with the prescribing generic medicine if there is a guarantee and assurity of the quality. Because we want the quality medicine just on the basis of the cost. We cannot compromise with the life of the poor people. Just in the sake of the affordable cost, you have to decide what is the affordable cost. Because if the responsibility is shifted from doctor to the chemist shopkeeper, who can decide which brand has to be given? It is an injustice. With the doctors who are qualified, trained and authorized, as per the Indian rule, that only medicine can be taken on a legible prescription by a doctor. If doctor has to prescribe only generic medicine, then why we are producing the branded medicine? Then we should stop branded medicine, only produce the generic medicine. Second point is MRP. MRP is under control of government. Government can slash the price of branded medicine. Number 3, it is a myth and misconception that the genericas are
identical,
cheaper.
Right?
Because in generic medicine, margin is huge. And when we shift this responsibility to the shopkeeper, he will give the medicine which is having a larger margin, irrespective of the quality.
Okay, Dr. Agarwal, let me ask you a basic question before I go across to my other panelists. Are you thinking about taking legal action on this order passed by the government?
See, we are trying, we will meet the government, and we are very sure that government will take a cognizance. Government is receptive and they will understand the basic point, the problem IMA has raised, and I am 100% sure that government will definitely come with the positive.
And if the government doesn't come with a solution, are you willing to pursue this legally?
That we will decide. We have not decided till now.
Okay.
But definitely let when the situation will arise, then we'll decide again and come with you.
Okay. Dr. Girish, in fact, let me go across to MC Mishra. Mr. Mishra, branded generics in India come with quality assurance. And the words branded generic is specific to India. They are generic drugs in that they are off patent. We are manufacturing them here, but they are branded. Why? Because they come from well-known companies like Cipla, Sun, Dr. Reddy's. And doctors across our country have come to trust these brands. They have a reputation for quality. Do you seriously believe that it is right for companies like Cipla, Sun or Dr. Reddy's to no longer be selling us, right, branded generics?
Vishnuji, thank you for keeping this debate. To answer your first, you already said that when the patent is over, then the generic medicines can be manufactured by anyone and everyone. And then you can sell it at whatever price manufacturer wishes to do so. But there is obviously every country, the government regulation and also the price control mechanism can be in place. But as regards generic, suppose a new drug comes up and there is no generic and patent is not yet over, what do we do for that? So they have not thought of it. I think it needs a little better in-depth thinking whether we should really enforce it the way it should be enforced. In principle, it looks good. But then the quality in India of generic medicines, as you see, anybody anywhere can start making these tablets. We don't know खड़िया है उसमें चौक है क्या है उसमें दवाई है और ये this is not something Vishnu that I have seen. The WHO did a study some 10-15 years ago and 40% medicines in tier 2 tier 3 cities were found to be spurious. You buy an antibiotic, you take it, it is not effective, symptoms are not relieved. We have limited personal experience also, having used buying these generic medicine and not getting what response we expect. Then salts are different. Some patient responds to one salt, the other patient does not respond to that salt better. So I think it needs a little bit more, and then you are giving liberty to the pharmacy, the chemist, that whatever he wants to give, he can give it in the name of generic. So that liberty you are taking away from the physicians when they know, and we all develop some trust in some medicines over a period of time that this works.
Okay, so I get the point that you're mentioning, and I think there's another factor over here. Dr. Mathur, come in on this point. Indian branded generic companies, right, whether it's Sun or some of the other companies I mentioned, they are innovative in that they've got different ways of delivering the drug delivery system. For example, some have constant absorption, improved absorption. They've worked towards reducing side effects. In other words, they're not identical to the original. And if they're not identical to the original, discouraging them could be problematic. In many cases, they're better than the original. Is that right?
Mr. Song, at the outset, let me extend my thanks to you and the NDTV for inviting me to this prestigious talk show. Since the release of professional conduct rules of NMC, this generic drug issue has rocked the minds of doctors. And I told you, it's a wrong notion that doctors are against generic drugs. Before proceeding further, let me clear there are 3 types of drugs available in Indian market: patent drugs, generic drugs, and branded generics. Patented drugs are those who are manufactured by a reputed international company after a great research and investing millions of dollars. These companies are giving a patent for some year exclusively to produce their drug. After the patent is over, other companies can produce these drugs.
Yes.
So in India, all drugs available are generic or branded generic. Branded generics are those who are manufactured by some reputed companies. Certainly, there is a quality control.
No, but sir, the question, Dr. Mathur, I was asking you was quite specific. Aren't Indian branded generics often not identical? For example, in the terms of how the drug is dispersed, if it's quick absorption technology, which has been used by some of our companies, the argument that it is a generic can be, you can argue that it's a flawed argument because there are changes. And I'll give you an example. And this is an absorption technology. Asthma patients in this country depend on metered dose inhalers of Cipla or of GlaxoSmithKline to manage their chronic condition, right? Now, a poorly qualified and ill-trained chemist will not be able to make the distinction to disperse, to use differentiated inhalers. So it's not just the drug, it is how the drug enters our body. And so these companies in India, which are marketing these drugs, have gone beyond just the drugs. So therefore, to argue and to say that no, it is generic, it's not really generic, is it?
Certainly, Indian companies have done many innovations. They have done innovations in the field of absorption,
Yes,
release.
exactly. That's my
And
question.
these drugs are certainly better than the generic drugs which are available in the market. And on generic drugs, there is no quality control. They are manufactured in an unorganized sector. There is no test of the bioequivalence, whether the drug contains the same amount which is claimed by the company, and there is no control of the cost also. 3-4 generic drugs are available at different cost. If government is serious about implementing generic drugs, then they should stop the licenses of all branded drugs and allow only generic drugs for the Indian patients, and have stringent quality control and a price control.
Okay. Mr. Mishra, how is this as a possible solution? Should the government roll out generics only for a certain group of drugs, for example, painkillers, right? And not necessarily do it for other groups of drugs which are perhaps more complicated and where perhaps a higher cost is required to acquire a certain quality of medication which may not be as easy to prepare or manufacture, even if it is out of patent. So can this be done in phases? Because I think we all agree that the goal is good, right? It's an ideal solution. It's not workable is the constraint.
Absolutely. I think you rightly summarized it that generic, as Dr. Girish mentioned, that government can say no longer now branded medicine, all generic drugs will be manufactured and then pricing will be accordingly. Only thing we have to make sure, how do we ensure quality of the drug? That this drug contains, if it is a 650 milligram paracetamol, it contains 650 milligram of paracetamol, no spurious nature or substance in it. I think that is the bigger challenge in India, and that is why our personal experience also goes with that generic at many times, particularly in remote areas, all kinds of spurious drugs are available. They may be harmful, they may not work. So somebody is having infection, we give antibiotic, it doesn't work, and then we say why the drug is not responding. And Vishnu, I can tell you, this is not today. 30 years ago at AIMS, chloroquine tablet was purchased by the hospital, and we gave this chloroquine to the patient. Patient will not responding. The fever is not responding. Proven malaria case. We will ask, okay, bring this X medicine from the chemist of that particular brand. We gave it to the patient. It responds. So this we have experience of that. This happens when a bulk purchase in hospitals also, the quality is sometimes not up to the mark. So you can imagine what these remote areas chemist will keep for margin. Somebody who gives more margin, and naturally those who are manufacturing with not using GMPs, there is a good manufacturing practice, can give that very low cost, and that will be very attractive to that chemist because he is getting more commission on that, more margin on that, and he'll be more prone to give that medicine instead of a quality medicine. So I think there are a whole lot of questions, and this, I think erstwhile MCI also had brought out this about generic. I think as far as possible, what NMC should say, that you prescribe generic medicine, either branded, and in bracket you write the generic component also. The patient, give the choice to the patient whether he wants that generic from X store or Y store, or he wants the branded medicine. We can spend the money. I think it's a cost issue. Government is more worried about cost, which is right, that the drugs have become expensive, even for us when we buy in the market. The drugs are expensive. There is no doubt. How to bring down that cost? Mechanism has to be evolved without compromising with the quality. I think that is where we have to put emphasis on. And when we are aiming at 2047 developed country, then we have to bring those kind of regulations. Like US, they also sell generic medicine, but the cost is not so much lower as compared to the cost of the branded medicine. And then there is a question of some patented drug comes, new drug comes today, antibiotic, for example, any antibiotic, patented antibiotic of a company. And for 5 years, the patent is on. what do we do? Do we not use that medicine?
Dr.
these
Agarwal,
are the questions we need.
yeah, important points. Dr. Agarwal, I'm just trying to understand, as far as wholesalers in this country are concerned, whether it's branded generics or unbranded generics, is it not true that they will only sell drugs which are profitable? Therefore, the goal of selling cheaper drugs may not always work. And as I understand it, I was reading a piece today, there are 8 lakh retailers in this country.
See, that is what Professor Mishra sir has mentioned the same thing. See, it is not only the cost. The important issue is the quality. If there is a process, there is a system in place that it is ensuring the quality of medicine. No doctor have any problem to prescribing any drug. See, as Dr. Mathur said very rightly, in India, we are producing, same companies producing branded, generic medicine with different MRP. If we believe that the quality of medicine is same, then why the MRP is different? Other point is, which I mentioned in the opening remark, the generic medicine has a huge margin up to 90%. The MRP is high and the cost price is very low. And because of the poor quality. And in comparison to branded medicine, they hardly had 15 to 20% of margin. And the contrary, the branded medicine, because of the competition, they have to maintain the quality. And they invest a lot of money for the research molecule also to bring the new molecule. So I think unless until, as you said very rightly, we should have a phase manner. Right? If we can control quality for 7%, we should put a target of putting another 10% in the next year, 17%, and slowly we should shift over the generic medicine once it is absolutely quality control.
So this has to be done, and obviously quality control is more than, I mean, and all of you mentioned that point. That's the bottom line, the health of people and the safety of people. Thank you all very much for being with us. This is something that we're going to track very closely indeed. We're going to move on now to another one of our themes, and we're looking again at healthcare. We're joined by a very special guest. Dr. Shyam Bishen is head of the Center for Health and Healthcare at the World Economic Forum. He's here in connection with the G20 meetings. Thanks, sir, very much for being with us. A lot of what India has been doing with our healthcare of late is associated with, for example, digitalization. For example, the rollout of vaccines for COVID on the CoWIN website is an example which perhaps other countries in the world can also use. Do you believe that there is technology which has been developed as far as digitalization is concerned in India, which the WEF or other players would look at from an international standpoint?
Absolutely. Thank you. Thanks, Vishnu. Thanks for having me on this program. First of all, I would truly commend Government of India for their effort in highlighting digital health during their presidency on G20. So we just had this meeting with the health ministers of G20 countries in Gandhinagar on Friday and Saturday, and digital health was a key area of discussion, key area of topic. And thanks to the Ministry of Health and Welfare, Family Welfare, for doing that. I do believe that digital health is a key area where India is already on the forefront, and it can champion and show the world how to move forward with regard to health data, with regard to breakthrough technologies, whether it's artificial intelligence, machine learning, virtual reality, all of those areas. I think India is right at the cusp of digital technologies, development on the digital technologies, looking at data in a different way, and then bringing it together on the healthcare side. So I do believe that India can show the way on the digital health side, and World Economic Forum, World Health Organization, and other international organizations are going to work with India in that respect. In fact, we just launched our Government of India together with World Health Organization, launched a global initiative of digital health during the G20 Health Ministers meeting last week, and World Economic Forum is going to work with them to take it forward. So
how is the world going to deal with pandemics better than we've done during COVID? Do you believe that, again, India, in having a massive capacity, for example, to produce vaccines, plays a key role?
Absolutely, absolutely. And there, India is going to establish a global medical countermeasure effort together with other organizations, which is looking just that. It's looking at how do we bring availability and access to safe, effective, quality, and affordable medical countermeasures, which includes vaccines, therapeutics, and diagnostics to the rest of the world. So India is, again, they are the biggest supplier for the vaccines in the world, and there is an opportunity here to do the same thing on the generic pharmaceuticals and the diagnostic side. So by establishing a global medical countermeasure platform, I think India is, again, is very, very well prepared to do that. The question is, do we need to manufacture everything in India, or should we also create regional manufacturing hubs around the world, which I think Indian pharmaceutical companies, Indian vaccine companies are quite capable of doing that.
Yeah.
So that we create a better access, a faster access to medical countermeasures in various parts of the world.
Dr. Bishan, one final question. To what extent did you look at climate change and health impacts at your G20 meet?
Yes, that was a key area of focus as well. I mean, we looked at three areas, as you rightly mentioned: digital health, pandemic preparedness, and the third one was climate and health, which included antimicrobial resistance, AMR. So climate change is a huge threat for human health. As you know, various disease areas, whether it's respiratory, cardiovascular, infectious diseases are growing, and they are growing quite fast. We see the change in geographical distribution of vector-borne diseases, mosquito-borne diseases such as malaria, dengue, Zika virus, encephalitis, and others are going in areas that never saw any mosquitoes and never saw these diseases.
Right.
So that's happening due to climate change. Climate change is also causing respiratory diseases because of the air pollution.
Yes.
Water pollution is causing other diseases. How do we prepare? So the discussion point was that how can we first of all quantify that what's happening now, and then we make sure we have research-based evidence, and then we take that evidence to come up with mitigation strategies. How do we look at adaptation strategies? So this was a big area of discussion in terms of collecting research-based evidence for human disease areas, for impact of climate change on human health, and then in terms of mitigation strategies and adaptation strategies, how do we move forward on that? And WEF, World Economic Forum,
Sure.
has already launched an initiative in this area, and we will be working with G20 health ministers and G20.
Yeah. Well, Dr. Bishan, it sounds like, it was quite the agenda with a lot of key issues which need to be looked at. Thank you very much, sir, for joining us today and highlighting some of the areas which you've looked at.